Welcome to the 5-Second Rule podcast. My name is Kelly Holmes, and I'm one of your co-hosts, and my preferred pronouns are she, her. Today, we are joined by a very special guest co-host. I'm thrilled to have Heather Ridge on the show as my guest co-host. Heather is the chair of APIC's Communications Committee, and she plays a vital role in making sure that the podcast happens. So I'm really excited to have her here today. And with that, Heather, I'll turn it over to you.
Thanks, Kelly. Again, I'm Heather Ridge, and my preferred pronouns are she and her. I am so excited to be here today as part of our Communications Committee. Our group is phenomenal. We have been working on this podcast for years, and I love the partnership and the synergy we've had with you, Kelly, and Lorenza, bringing information out to our members and beyond. I've been on the Communications Committee now. This is my 7th year. I've been in IP for over 18 years, so this is my passion and where I want to be. So I'm really excited about our topics today, and I get to introduce a dear friend, Grant Quiller. He is a dual certified industrial hygienist and a safety professional with over 17 years of field experience. He received his bachelor's degree in environmental health from Colorado State University and a master's degree in industrial hygiene from the University of Washington. He has diverse experience across healthcare, construction, industry, and litigation. He currently works as an industrial hygienist in the infection prevention department at Novant Health, serving the greater Charlotte, North Carolina region and beyond. So welcome.
Yay. And we have one more guest, and I get to introduce Spencer. So Spencer Baker is the first industrial hygienist at the University of Iowa Healthcare. He received a bachelor's degree in public health from Brigham Young University and a master's degree in occupational health and safety with a focus in industrial hygiene from the University of Iowa. So over the past 3 years, Spencer has partnered with clinical and facilities teams to reduce infection risks by advancing initiatives focused on hospital infrastructure and environmental safety. When he's not working, Spencer enjoys being outdoors, spending time with his wife and 2 kiddos, and binge watching Survivor with a bowl of his favorite dark chocolate brownie ice cream, which makes me hungry. That sounds amazing. Welcome, Spencer.
Yeah,
Thank you. I'm excited to be here.
Dark chocolate fiend myself. Totally get that one. All right. So for some of our listeners today, you may not even know what an industrial hygienist is and what they do. So gentlemen, explain to us, what is your role and how did you find your way into it?
Yeah, great question. And I've definitely had to answer this question quite a few times. So traditionally, industrial hygiene, we like to think of it as the anticipation, recognition, evaluation, and control of hazards. So you could think about this as your team members in your healthcare facility, but also for your patients in your healthcare facilities. When we talk about hazards, we can think about chemical hazards. So those that have been around a while, you might recall a glutaraldehyde in maybe your high disinfectant facilities, or also your SPDs, some of those nasty chemicals that we deal with and those employee complaints that we may get. We can also think about biological hazards. You can consider Legionnaires or Aspergillus in your facility. Hopefully you don't have any of that, but those can definitely be considerations, along with also physical hazards. So thinking about noise, heat, radiation. So all those items kind of fall under the umbrella of what industrial hygiene does and how we can help support healthcare facilities. How did I find this role? So while I was at university, I was on my way to medical school, using my scientific and analytical mind. And some students were actually performing some research projects in Central America where they were going down and evaluating indoor burning cook stoves. So actually, if you think about the world, roughly a quarter of the population, or 2 billion people, rely on open hearth fires, so 3-stone fires, as their primary means and methods for heating and cooking for their families. You could think about it as having a fire inside your living room. So oftentimes it's the women and children who are exposed to that. So, and it's equivalent to smoking 2 packs of cigarettes a day. So upper respiratory infection is still a major infant mortality driver in the developing world. So I got to play with fun tools, which I love tools, and we have some tools here today to show you. But I got involved on the industrial hygiene side where I was doing those quantitative assessments, looking at carbon monoxide and particulate matter. So from there, I decided, hey, is there a potential way I can make this a career? And I went on to get my master's from the University of Washington, and it was actually through a education and research center, which is funded through NIOSH, which is the National Institute of Occupational Safety and Health. So I was able to get my master's funded through that program, and from there kind of kick off my career as an industrial hygienist, where soon after that, I went to work for OSHA as my kind of first industrial hygiene career.
What a fascinating journey. And I love that I'm hearing the words patient safety and that passion for taking care of people just resonate. Spencer, what about you?
Yeah, so just like Grant, I was first exposed, pun intended, to industrial hygiene in my undergrad. So I was a public health student. One of my professors, he was a certified industrial hygienist. And where I did school, there was a lot of inversions. And so he decided, you know what, today we're going to go out and do some air sampling. It was the first time I'd ever heard those words, first time I'd ever actually handled the equipment. But he taught us how to assemble this equipment. We went outside, collected samples. And then the next day we came back and we took apart the samplers. And I still remember how I felt taking apart this sampler, not really knowing what to expect. But when we took out these little filters, probably about yay big, you could actually see some of the particulate matter pollution on the filters themselves. And I was just baffled. I was like, oh my gosh, this is so cool that you can like take some instruments and use them to paint a better picture of the environment that we live in and associate them with health risks. And so that got me intrigued, and I followed some advice from some mentors of mine and actually started working as a part-time industrial hygiene technician during my undergrad. And there I was very appreciative of the variety of work that I was exposed to, as well as just the selfless nature of this job. It's really rewarding being able to just protect people while they're at work, and so they can return home safely to their families. So with that in mind, I started a master's degree after graduation at the University of Iowa, where I did research in pesticide exposure to agricultural and groundskeeping workers. And then getting close to graduation, I saw that a job at the University of Iowa Healthcare opened up for an industrial hygiene position. On a whim, I did not expect to get it. I felt very underqualified, but on a whim, I applied, and the hospital took a chance on me to build out the inaugural IH position. And here we are 3 years later, and I'm loving it.
Oh, I love it. All the passion in your voices. It's fantastic.
I love it too. And that was funny when you said inversion. Do you mean atmospheric inversion? So your professor was like, oh yeah, we're trapping in the pollution today. Yeah. So / meteorologist, industrial hygienist. That's super interesting. So, I feel like a lot of people don't know what infection prevention is. If you're out, just talking to your friends and they're like, what do you do? And you tell them and they're like, what is that? And I feel like you guys probably get the same response, maybe even more. So how common is it to have an industrial hygienist in the healthcare setting or even incorporated into the infection prevention team at a hospital?
Totally. I think infection preventionists, they can relate. I think IPs, they do so much behind the scenes work, just like IHs. And it seems like sometimes they're underappreciated, at least until something actually happens and brings them to the forefront. So we can definitely relate on that level. But IH, it's definitely a growing field in healthcare. I think for a while now, IHs have had a small presence in healthcare, specifically focusing on EHS, or environmental health and safety. Ultimately, what that is it's focusing on the employees while they're at work, versus infection control. It may have more of a patient safety kind of focus. But the COVID pandemic really shined a light on how an industrial hygienist training and experience may be beneficial for infection control. IHs, they're well versed in a variety of topics, such as like engineering controls, aerosol technology, ventilation, personal protective equipment, and a number of other things. And so just that background and experience in those areas are very, very helpful in dealing with things like communicable diseases. So I would say since the pandemic, we have seen a growing number of IHs in healthcare, particularly in the infection control realm.
Yes, yes. And Grant, what about you? Do you have anything to add to that?
Yeah, just to build off of what Spencer was saying, traditionally, I think definitely industrial hygiene was more involved on the occupational health side. So you could think about going and getting your respirator and getting your fit testing and those types of things. And then also with, obviously, I think the environmental health and safety teams and those certain aspects that they deal with. So anywhere from your bloodborne pathogen to your chemical safety, even your radiation officers that you have in your hospitals type of settings. As Spencer said, when COVID happened, it definitely kind of flipped the paradigm quite a bit. I was actually working at OSHA during that time as a compliance officer, and that was when OSHA rolled out their emergency temporary standard, which was applicable for healthcare settings. So obviously, a lot of us have lived through that. It really turned kind of healthcare associated infections on its head. Now we're oftentimes thinking about our providers and our team members and critically thinking about, okay, now we're going to be under that critical lens of compliance. Now we actually have OSHA inspectors coming to our facilities and evaluating our respiratory protection program and talking about our HVAC systems and airborne isolation rooms and MERV ratings. What are these types of things? So it really helped, I think, introduce our value that we could bring specifically to a healthcare setting and then also within infection control and infection prevention.
That is so true about COVID really elevating the role and the safety pieces, looking at room air clearance times, when is it safe to go into the room, how long to keep the next patient and team member safe. It was a lot of work, and you're right, it's a lot of it's behind the scenes, and people don't see all this magic that happens on a day-to-day. There's a lot of math and a lot of science in place. So when you're looking at how you use industrial hygiene, what are some of your focus areas specifically to healthcare, and how do you really coordinate and do your work with infection prevention teams?
Yeah, so as I said, traditionally, I think we were oftentimes more affiliated with the environmental health and safety teams. But I think that's also kind of parlayed into working more with ventilation. So you think about your operating rooms and what those kind of specialty ventilation systems look like. Spencer and I, our background and our training, we could go in and help evaluate that because oftentimes, especially what I've been seeing and have come to become familiar with, once it's kind of commissioned, it's kind of set it and leave it. So what about like troubleshooting, or what if things changes, or can we contribute and let our knowledge kind of help with those type of systems? Similarly, you could think about airborne isolation rooms and what those look like and who's going around and checking on those, and what happens if we need to potentially troubleshoot some of those. Will a Kleenex test actually be, the validation we want to ensure that our providers, patients, and everyone's being as safe as they can? Along with it, as you just mentioned, clearance times. Similarly, we also can talk about bloodborne pathogens and all the parallels that we can get involved there. And I think where most of my value is added specifically within infection prevention is that there's a big kind of language gap between our acute healthcare facilities and within our infection prevention. So you can think about our facilities teams and our plant engineering teams. They are there maintaining and servicing and ensuring that our facilities, our environment of care is going to be a healthy and secure environment for our team members to excel and our patients to heal. Nurses didn't necessarily go to construction school. And so there's a lot of opportunity to help bridge that gap and communicate those risks and just connect kind of those gaps. Similarly, you think about some of our aging infrastructure. There's some numbers out there that say, 3,000 to 4,000 of our hospitals in the US alone are antiquated or obsolescing. So even if you think under our Novant Health footprint, we have a hospital that was opened in 1917. So when the US was entering World War I. And you could think, wow, that building has not had a day's rest since then. And so the stress and strain that's constantly put on these facilities, they never have a day off. There's a lot of work that goes in behind the scenes. You can start thinking about all the focus that infection prevention has on HAIs. There's also a lot of HAIs that can be contributed to potentially maintenance and construction activity. So I've seen numbers as high as potentially 5,000 deaths associated with HAIs due to construction and maintenance activities. So having someone with that requisite knowledge and expertise that can bridge that gap between facilities, construction, maintenance, and our nursing team and healthcare team, there's tremendous value added. And also all the oversight that goes into that has been really a great place to be. And I can see how beneficial it has been specifically within our system. And I'm sure Spencer can speak to the same kind of benefit added.
Totally, Grant. I mean, I think you hit the nail on the head on that one. I mean, I think one other area that you didn't quite touch on is just the inclusion of new hospital disinfectants, and how do we go about bringing in new disinfectants. IPs are very familiar with disinfectants, kill time, kill capacity. And I think just that area is an excellent opportunity for IHs and IPs to collaborate. IPs with their knowledge of kill time, et cetera, and the IH's experience in safety and hazard risk assessments, kind of assessing it from an employee safety point of view. It's like two birds with one stone. I mean, you can really get a full idea, full picture of what bringing in one specific type of disinfectant into your hospital will look like. So IHs, they love to focus on frameworks. And one popular framework is the biological exposure framework. And ultimately what it is, it's the indication that any type of organism starts out at the source, it goes through a transmission pathway, and then it ends up at its host. And so as IHs, we love to think, okay, how can we disrupt that pathway? And one of the ways that we do that is we focus on a variety of controls. Some of you may remember from the COVID era, the hierarchy of controls, which kind of outlines the most effective ways to protect an employee or patient from a variety of hazards, which in our cases in infection control, we're often thinking from the biological standpoint. And so as IHs, we look at the whole framework. I will say, I think we spend most of our time focusing on the top three tiers of that hierarchy. So focusing on how can we engineer this hazard out of the workplace? How can we change our administrative practices? Or is PPE necessary to keep patients safe? Those are the questions that we're asking. Those are the kind of the things that we're thinking about.
Oh, I love that. And it really does bring it full circle, because I think as infection preventionists, we're trained in looking at, kill time. And then, like you said, what is the disinfectant going to kill? But you guys bring in this other perspective about, how's it going to affect the employees or the patients, with these certain types of chemicals. And that's an expertise that we don't always have. So that's, incredibly valuable to just look at the full picture. And so I heard a little birdie told me that you guys love your tools in your practice. So I was hoping that you could maybe talk about some of your tools. And Grant, I think I might have seen a spoiler that maybe you brought a little bit for show and tell.
Maybe.
Well, I'll make it a little more dramatic and have Grant go first, or a second. How about that?
Okay. Yeah, this is.
I apologize. I didn't bring any. I should have though. But let's see. So I'll introduce maybe a couple pieces of equipment that I love and probably use the most frequently. The first one is a particle counter. So this piece of equipment is really cool. It can be used as a surrogate analysis, basically, for air filtration efficiency. So it's a little handheld device, and I can bring it around on different construction projects oftentimes. And what I'll do is I'll use it to help determine, okay, these negative air machines or air scrubbers in the construction area, are they functioning the way that they should be? They're brought around from project to project. There's different filters inside of these pieces of equipment. And so was it assembled correctly? Is there any damage that means the air isn't being filtered the way that it should be? That's kind of what I use the particle counter most frequently for. I also have a viable air sampler, and this one is really cool. I just got it about a year and a half ago, and it's very unique. Really what it does is, again, it's a handheld device, and it collects air samples on a little petri dish that I send off to the lab to be analyzed. Usually what I'm looking for is fungal spores, and I will use this to help verify the integrity of brand new HVAC systems. So, for example, we just constructed a brand new hospital about 15 minutes down the road. And these contractors, they're expected to follow clean duct protocol as outlined by SMACNA. SMACNA stands for the Sheet Metal and Air Conditioning Contractors National Association. So it's a mouthful. But they have guidance on how these HVAC systems should be installed in a way that's safe for healthcare. And so they should be following those. And my mantra is, I trust, but I verify. And so what this piece of equipment does is it helps me verify that clean duct protocol was followed and that the systems are safe. And last but not least, I think I also have a manometer and a little smoke pencil, actually. Think of like a super miniature version of a smoke machine that you can just carry around in one hand. And it's really useful. I'll use it in different rooms to kind of paint a picture of the airflow within the room. What are the air currents looking like? And if I was a little tiny aspergillus spore, kind of where would I go in this room just following the air currents? It's a good little exercise. Go ahead, Grant.
That is cool. That is very cool. Can you get that on Amazon? Okay.
Yes, you can. And I know this is the first time we're using video, but they are absolutely great tool. And just to have that visualization aspect to it is a huge training component, because oftentimes we're talking about a negative 0.03 inches here or negative 0.02 inches here. But to understand that and to visualize it brings your training aspect for your contractors and your vendors and also your nurses, and why these airborne isolation rooms are so important, and just can really help, further validate that and drive those points home. Other pieces of equipment that we love too, we have indoor air quality monitors. So this can tell us carbon monoxide and what that is. So we can often evaluate even further how our HVAC systems are functioning, and are we getting enough clean air circulation into these spaces. Particle counters. We also have, moisture meters. These are very handy tools. Unfortunately, you think hospitals are the cleanest environments, but we know that accidents do happen, and these water events with all these pipes and the serious stress and strain that we put on our infrastructure, that these things happen. So how can we see that water? We can use tools and kind of evaluate what's the impact we're having. How can we reduce the scope of the remediation work that we have to do and ensure that we get this space up and running as soon as possible again. So yeah, lots of fun tools, and we love to use them as much as we can. And to that point, it's also important for us to quantify those numbers, because to associate the amount of risk associated with any of these potential hazards that we've been discussing. And that can drive, what action steps we may have to take. And with action steps, there's always costs associated with those as well. So we can help hopefully reduce that and try and contain some of those as well.
Oh, that's so impressive. And having an industrial hygienist on the team that can interpret those results. Because if I just went in with my Amazon purchased piece of equipment, it would be a mess. But, I just think about all of the concerns that get brought to us by employees that might have to do with indoor air quality, and someone in a particular office or department, they're experiencing some issues. And, that takes us a while to find the right people to test the air, to fix it. But having an industrial hygienist on the team, we could just turn to you in the office and be like, hey, do you mind checking? And, what a quick way to, solve that problem versus, having to call external partners to come in the time that it takes. So that's extremely valuable. Thank you guys for sharing, and the show and tell. Loved it.
It is. And Spencer, it really resonated. Trust but verify. That is such a true thing, right? We can say we're 100% all the time, but these tools that you guys use, they show us what's happening. So we can say, yes, definitively, ooh, this room is dirty. That particle counter is not looking good. So great, awesome tools. And thank you for the smoke there, Grant. That was fantastic.
Absolutely.
Love it. All right, guys, we're just curious too. So there's a lot of overlap with your infection control partners in the hospital and your industrial hygienist role. And so what does your normal day or week look like in your partnership?
Yeah, so I think we're talking about tools and everything. I think our most handy tool is probably going to be our cell phone, right? Because we have to serve as a trusted resource of knowledge for any of these items that may come up. So I'm always, keeping my phone handy for these leaks or accidents that may happen 5 p.m. on a Friday or over Thanksgiving, as we had most recently. So what our day-to-day looks like is, ensuring that we have those relationships in place, and that when those things do come up, they feel like they can call and reach out, and we can have a discussion about the appropriate means and methods that we need to take to ensure that we're providing a safe environment for our patients to heal and also for our team members to work in. So another aspect of that would also be the planned project work. Spencer just talked about the new hospital that they built. So oftentimes you want the newest, latest, greatest technology for your operating room or for your radiology department. But can we actually shut down one of those very expensive CT scanners so we can go in there and install this equipment over a week or 2 weeks that it takes? Talk to any radiology head department, and any downtime is something that they do not want to have. So how can we effectively control the construction work that is going to be occurring in these types of settings? So it goes back to our infection control and risk assessments that we install in place. And so with that comes a lot of training, especially for our contractors and our vendors coming in. And then the oversight aspect, as Spencer said, using those particle counters to ensure that the HEPA machines that are moving air are appropriately filtrating the air and not pushing, construction dust and making it now hospital dust. Also looking at containments, those types of things. So that definitely does occupy a lot of time. Along with that, a lot of construction projects have a lot of meetings that go into it. And so ensuring that from the infection prevention hat, that we're having the effect that we want on these new facilities that are being installed or constructed. Obviously, we always have the IAQ issues that come up, and that does take up a good portion of our time. And then just further beyond that, as I think many of us always work on, we also have our policy work that we have driving our new ICRA 2.0 that we have out there from the Association of Safety Healthcare Engineers. And then also training for our vendors, contractors, and even our team members who might be just got brought on to the plant engineering or facility team. So that's definitely what I see taking up most of my time. And obviously, I'm actually the second industrial hygienist working within infection prevention for Novant Health, and we can see the value added on a daily basis.
That is so true. Grant and Warren are busy bees. They are all over the place helping everyone out, especially with all these construction upfit projects. Spencer, what about you? Do you have anything unique to your day-to-day operations?
Yeah, well, Grant's totally right. We spend a lot of time, with facilities teams. Construction projects, they're large, they're complex. And so we're involved all the way from the planning stage to the implementation of ICRA, as well as the downgrade of ICRA precautions. So those projects can take months, they can take years sometimes. And so those take up a lot of time for sure. Also, there's a lot of collaboration that goes on between maintenance teams and day-to-day operations. Grant alluded to a Thanksgiving event, I think maybe water-related, I don't know. But things like that happen regularly. And so, how can we address those issues while not putting our patients at risk? And then I think also a lot of the things that I'm involved in are more project driven. So focusing on specifically engineering controls and how we can engineer various healthcare hazards out of the environment. So for example, a hot topic right now is UV. And I'm sure infection preventionists are very aware that that's out there and that it's a possibility for helping cleaning healthcare facilities. And so we use UV in our hospital. And so some of the stuff that I'm involved in on that front are, assessing how it's being used. Is the way that we're implementing UV the most effective way of doing it? Or do we need to alter our practices somehow? And so, verifying that process and making recommendations on how we can improve it. That's often what I'm found doing, as well as I'm constantly looking for ways that we can improve infection control throughout the hospital. So there's new types of UV that are coming out, as well as I think one thing about my job is that a lot of the items I'm involved in are project-driven, project-specific. So looking at how we can engineer our facility better that improves infection control practices. So one example is the use of UV. UV, it's a hot topic right now, and I'm sure there's lots of infection preventionists that are currently looking at, or maybe your facility is even using it. And so we use that here. And so what I'm often doing is I'm assessing and evaluating how it's being used. And is that the most efficient way of using UV? Or are there ways that we can improve it to be more efficient? As well as I'm also looking at just generally new technologies as they come out. What can we implement in our hospital that's different and can maybe create a more passive approach to infection control? I love the idea of passive controls because they're always going on in the background. It's not like PPE where, you put on your gloves, but maybe you put them on incorrectly or in the wrong order as other PPE. And so I love the idea of having passive devices out there, such as like far UVC running on in the background and keeping our environment safe.
I'm really glad you brought that up, Spencer. So when you talk about UV, are you talking about like the UV lights that they put in HVAC systems, or perhaps the UV lights that are like on the upper part of the wall in certain EDs I've seen, or total room disinfection, or all of the above?
A little bit of everything, actually. Yeah. So we use UV in our HVAC systems to protect the coils. There's some misconceptions about how UV is used in HVAC, and while you can use it to disinfect air, the way that we are currently using it in the HVAC is to keep the coils clean. We also use UV in the form of little robots that will be rolled into a patient room after terminal clean, and it'll be kind of one last effort to clean the room. As well as we also have UV incorporated in some of our water systems as well.
Oh, that's really cool, and kind of takes me right into our next question. So you guys have talked a lot about construction. You've talked a lot about remediation and the amazing role that you play. So what about like our water safety programs? We have to do that water risk assessment every single year. And that can be really challenging for infection preventionists who are not familiar with like how the water system or plumbing works, but then also environmental sampling. So I don't know if you guys have had this experience too, but healthcare workers coming to you and saying, hey, let's culture the doorknobs, or all these infections are coming from the curtains. Like, let's culture the curtains. And I know that it has, a time and place where that is appropriate, but could you tell us how y'all play a role in those types of situations?
Yeah, for sure. So first off, there is no Plumbing 101 course in most industrial hygiene master degree programs. Okay, at least right, Grant, did you have one?
No, unless you go to YouTube University and your first home ownership, I think, where most of us get that.
Definitely. So I will say at IHs, they're not plumbing experts. And so if an IH is incorporated in a water management plan program, there will be some initial training, I imagine, on day one. I think there are very few IHs that would feel 100% confident on day one, but they can definitely be trained on certain aspects that they're not familiar with. However, there are advantages to having an IH on a water management team. And one advantage I would say is just their background in developing sampling strategies. IHs, we do this so frequently where we develop sampling plans for a variety of hazards. And so just taking any previously created plan and then adopting it to water management, it's a pretty smooth process a lot of times. There are some nuances and some differences, but we feel very comfortable in that process. Also, I mean, IHs, they're often more familiar with industrial equipment, as well as different sampling methods. And so you think about how you can collect different water samples. You can collect cultures, which is kind of the gold standard. Sorry, collect water samples to be cultured. Or there's the use of PCR too. There's some pros and cons to that as well, just as there's culturing. And then IHs, we have a lot of experience interpreting lab results. Often those can be a little confusing. And so the fact that we're looking at lab reports on a regular basis, we know exactly what we're looking for, and we can definitely help interpret the data. And one thing, I will make a plug, shameless plug. I have a friend, she is an industrial hygienist, and I heard through the grapevine that she may be giving a little lecture at APIC this year on water management. So if that's true, definitely go and watch her presentation.
I love that. I will definitely be on the lookout for that presentation because I would love to learn more. Grant, what about you? You know, if I come to you and I say, "Hey, we need to sample our curtains," what's our plan of action?
Yeah, I think oftentimes it's just putting in that kind of risk-based approach. Anytime you do any kind of sampling, first of all, there's going to be costs associated with it. As an certified industrial hygienist, we're going to follow proven analytical methods, standardized methods, send it to a certified lab, and all that has associated costs associated with it. Then we're going to have to interpret those results. You don't want to go sampling for something and then not know what your expected results might be, and then further beyond that, also have a potential remediation or action plan to follow. So sampling just for the purpose of sampling is oftentimes a bad rabbit hole to go down. So putting that risk-based approach framework onto any of these kind of environmental sampling or water sampling can definitely help reduce costs and then also further drive your water management plan. Beyond that, oftentimes thinking about what are the risks associated with your water management plan? How can we help control that? I brought up Legionnaires kind of when we first discussed this, but thinking about, okay, what about our HVAC or cooling systems, cooling towers? Do we have a preventative maintenance program? Are we ensuring that we're cleaning and reducing any potential biofilm that might be out there? And do we have a way to track that? And I think that's we have a very robust program here at Novant Health, and obviously very happy to partner with all the team members as we continue to have success in that realm.
Whew. You guys are involved in everything. And I'm sitting here thinking, for those who have industrial hygienists on their infection prevention teams, we're like, whoa, we're so lucky. But there are so many teams out there that don't have the luxury of having access to industrial hygienists. And so they struggle. So, a couple of things. Well, hey, what do they do? Where do they get some resources? And second off, how do they get somebody like you on their team? Like, give us some tips that we can help talk to their senior leaders and get you involved.
Yeah, industrial hygiene. There are not too many of us out there, so we are kind of harder to track down. And I'm sure you can definitely give me a call, and I'm sure you could give Spencer a call, and we'd be happy to have a brief discussion with you. Beyond that, there is our national association, the American Industrial Hygiene Association. And through there, they have a find a consultant tool. So you can kind of go through there and find a local consultant who may be able to help you out, typically probably on a project-based kind of expectation. One step further, OSHA is also available. So depending on the size of your Facility Network Corporation, they do have a free consultative program where they can come in and help navigate whatever kind of issues you might be having, specifically from an industrial hygiene aspect. And that's a free service that's provided through all the states. So those are some potential really great tools that can help benefit you and your facility and programs.
I'm really glad you said OSHA as your friend, because some people get so nervous. If I call OSHA, they're going to come in and no, but OSHA is your friend too, right? They're there to help. So I think that's a great message to spread. Hey, Spencer, what about you?
Well, going off what you just said, I mean, look at how happy and friendly Grant is. And you worked for OSHA at the beginning of your career. So, I mean, you could get another Grant at your doorstep helping you out. I know I would love that. So, but yeah, to answer your question, so if you don't have an industrial hygienist on your team, I mean, ultimately it may fall onto an IP to really develop that rapport and relationship with the facilities teams. And so what I would recommend is take an afternoon and shadow your facilities team. Maybe push your IP brain to the back for the afternoon. Leave your clipboard in your office because you can think about IP stuff later. Just go in there and just learn. Ask questions, be vulnerable, because most people love talking about their jobs, love talking about what they do. And so odds are the facilities team will eventually open up to you. They might be a little skeptical at first, but take that time to really understand, what is it that you do and how do you do it? It's really helpful and it will go a long way. The second part of your question, I think, alluded to getting an IH on your team. Mm-hmm. If that is your desire, I mean, we're both a little biased, but we definitely would encourage you to be vocal with your leaders. And anytime that there's an incident or a project where you feel like an IH would really benefit, tell them, be vocal, be loud, and be consistent. So a little background about how this position was created. It was only 3 years ago. Our hospital epidemiologist was hired on, and I think it was back in 2021. And one thing that she made very clear was that she wanted an IH on her team. And she's quite a relentless person, very persuasive as well. And so it took a couple of years, but eventually she was able to get this job opened and now filled. So, it's a great thing to have an IH on the team, but it takes a lot of consistency and hard work to try and get them on the team. So, the hospital I work for took a chance on me, and maybe your hospital will do the same. They'll take a chance to.
Oh, I love that.
I love it too. That's great.
And, Spencer, in an earlier conversation, you had mentioned how the facilities team is one of the unsung heroes of healthcare. And, that really stuck with me when you said that, because we do talk about our unsung heroes and our EVS workers and what a critically important job they have. But if you think about, what we take for granted, that the water is running and it's safe to drink and safe to wash our hands, and that we're in a temperature controlled environment where the air is safe to breathe, they really do a lot behind the scenes, as well as industrial hygienists, to make sure that we're safe. And I love that advice about, if at first you don't succeed with your request for an IH on your team, just keep on keeping on and asking. So to wrap up our episode, we have something fun for you guys. It's our word association. So I'll let Heather kick it off for us.
Okay, so we're going to throw it out there, and what pops to your head. All right, so your topic is code brown.
A poopy mess. Uh-oh.
That's fair.
Yeah, I have a toddler and a 1-year-old, so poo is definitely the first thing. Yeah.
Okay, great. So, Grant, this one's for you. North Carolina.
North Carolina, come on and raise up. I'm a millennial, so I might be dating myself, and I'm also live in the state, and my son was born here, so I have a lot of affection for it. And also P.D. Pablo, it was a great song and still slaps. So
I would have never thought of that one. That's amazing.
All right, Spencer, what about this one? Boston Rob.
Ooh. Ooh. Manipulative. Do we need some context?
Well, we know you're a Survivor fan. Yeah. Have you watched all 25 seasons or how many ever seasons of them? But yeah, Boston Rob, everybody knows that name. But yeah, manipulative. What's your context?
Well, no, just, yeah, if you haven't seen the show, definitely take a watch. He's a great player, but well, I don't want to speak ill for the guy. Go watch the Boston Rob seasons and come up with your own opinion, I guess. That's what I'm going to say.
I love that. Well, you guys, I really appreciate you being on the show with us today and opening up our minds to industrial hygiene and how that can play such an important role within the infection prevention team. And I'm hoping that this language that we're hearing today becomes more and more integrated into our practice. And we hear, about more opportunities for industrial hygienists to join the infection prevention teams. So thank you both. It was a pleasure meeting you. And I loved the show and tell as well.
Yes, I agree. You guys were wonderful. Thank you for all that you do for our patients and our team members. And everybody's going to want you after today. So
it's true. It's true. Your inbox is going to be flooded.
It's going to be flooded. They're going to be superstars.
Hey, I think I can speak for Grant. We welcome it. We're happy to help out wherever we can. And thank you so much for having us on the podcast. We loved it.
Truly a pleasure. Thank you.
Thanks, everybody. Have a good one.
Thanks for listening to APIC's 5-Second Rule Show. We want to hear from you. Visit us at www.5secondruleshow.org. That's with the number 5, where you can contribute to the conversation. Make sure you subscribe and rate us wherever you listen to your podcasts. We're so appreciative of the hard work each of you do every day to make a safer world through infection prevention. Remember, IP stands for Important Person. You are awesome. Stay safe, and we'll see you next time.